What is hantavirus? Who does it affect? And are we at risk for another pandemic? Hi, my name is Mehret, and I am making this video in collaboration with Victoria Oyiya Health Foundation. Hantavirus is a virus mainly carried by rodents like rats and mice. People usually get infected by hantavirus by breathing in tiny particles contaminated with rodent urine, saliva, or droppings, especially in poorly ventilated areas. Hantavirus can cause two major types of illnesses: the hantavirus pulmonary syndrome, which affects the lungs, and the hemorrhagic fever renal syndrome, which affects the kidneys and blood vessels. The current public health topic, which is the Andes virus, is classified under the hantavirus pulmonary syndrome. Early symptoms of the Andes virus can look a lot like the flu. Symptoms include fever, fatigue, muscle ache, and nausea. But in severe cases, it can quickly affect the lung and cause serious breathing problems. Hantavirus symptoms don't always show up immediately. In some cases, it can take up to 6 to 8 weeks for symptoms to appear after exposure. Because of that, tracking and monitoring people who may have been exposed, even if they're not sick yet, is necessary. Health officials are currently monitoring this outbreak, which is linked to the cruise ship that set sail from Argentina last month. A couple first showed symptoms, then later, 3 people from that cruise ship lost their lives. So far, there have been 11 confirmed cases. What makes this outbreak unusual is that it involves the Andes strain of the hantavirus, which is one of the few strains that could sometimes spread from human to human through prolonged and close contact. But the WHO is saying that the overall public risk remains low, and this virus does not spread as easily as influenza or COVID-19. So no, experts are not calling this another pandemic. But scientists are paying attention because hantavirus can be serious in some cases. There's currently no cure for hantavirus, but early medical care can significantly improve survival. And the best prevention is avoiding rodent exposure. The key right now is awareness, accurate information, and avoiding unnecessary panic.